Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Lindsay Smith-Rogers. Today, what happened to doctors spreading misinformation during the COVID pandemic? Lena Sun, an author of an investigative series at the Washington Post, speaks to Dr. Josh Sharfstein. Let's listen.
Lena Sun, it is so great to have you on Public Health on Call. I have been meaning to call you as soon as I saw your investigation in the Washington Post called Doctors Who Put Lives at Risk with COVID Misinformation Rarely Punished.
Thank you, Josh. Happy to be here. And it's actually a subject that I was thinking about looking into for many, many months before we started.
So doctors who put lives at risk with COVID misinformation, what are we talking about here?
We are talking about doctors, especially at the height of the pandemic, who were jumping into the vacuum where we didn't know that much about the virus and saying all sorts of false and misleading things, not only about COVID, but about benefits of masks, benefits of vaccine, benefits of treatment. And this was something that we looked into for months, my colleagues and I, Lauren Weber and Hayden Godfrey.
And were you looking particularly at doctors who were taking care of patients and maybe advocating against vaccination or prescribing them useless or potentially dangerous medicines? Or were you looking at doctors who were going on TV, going on the radio and telling everyone not to get vaccinated or to use unproven treatments?
We were looking at the entire landscape. We wanted to know in a most broad way if any of these doctors who were both spreading misinformation and prescribing not recommended treatments to patients were being disciplined in any way. And what we found was that those doctors fell into both categories, but the ones who had actions taken against them were typically the ones where they could link patient care.
Now, you're using passive voice a little bit. We're disciplined. Who does the disciplining? How does our system work? If doctors go out and take bad care of patients or they say things publicly that are flatly untrue, whose job is it to police that?
There's something in every state called the State Medical Board. This board is typically made up of doctors and perhaps some members of the public appointed by the governor. And their job is to make sure that doctors licensed in that state are taking care of patients and not harming their health. And they have to follow the laws in that state. And we have 50 states. So there's a range of actions because, again, they're appointed by the governor. So these bodies do have a political bent.
In this article, you looked at all of these medical boards, at each of these medical boards, to see whether they were taking action against physicians who were spreading misinformation. And what did you find?
We sought records from every state, and in some cases, there was a medical board and an osteopathic board. And we found over 2,500 documents. We interviewed over 130 people, some of them former board members. And we found that there were very few repercussions for doctors who took part in this kind of action. In fact, there were about 20 doctors who had been penalized nationally. There are over 1 million licensed physicians in this country.
Could you give me an example of a doctor who was penalized?
The penalties range. And so the most serious penalty is if a doctor loses his license. As we say in China, in Chinese, you lose your iron rice bowl, right? So only one doctor lost his rice bowl, and that was a doctor in Oregon, Stephen LaTulip, who was giving false information about the benefits of masks and other treatments to his patients. He told one patient that the mask was the reason she had high blood pressure. And he told another patient that the mask could cause all sorts of other problems for her, which were blatantly not true.
That seems pretty egregious. I wonder if there were other doctors like that, why there were so few disciplinary actions that you found.
These boards are historically underfunded and weak. They are also responsible for a lot of other mundane things like issuing licenses, and the same staff that have to do those other tasks have to be in charge of these investigations. And in most cases, The boards can't even begin an investigation until someone files a complaint. And the process is very lengthy and time consuming. Finally, I think, as I mentioned earlier, these boards are appointed by the governor, and there's just so much politics in our country. I think that has something to do with it as well.
Well, in your article, you mentioned that in some cases, state legislatures were actually tying the hands of medical boards about what they could do in this area. Could you explain that?
Yes, we found that there were at least 6 states that had taken action to specifically limit the authority of the boards. So on the one hand, you have a board that's already kind of weak, under-resourced, isn't able to function that well. And then on top of that, you have a state law, or in some cases, an opinion from an attorney general saying you specifically cannot discipline doctors if they prescribe ivermectin or hydroxychloroquine.
These are 2 of the treatments that had been touted, but then by the time you're talking about had been pretty thoroughly debunked. The state legislatures are basically giving immunity for this prescription, no matter what the medical board says.
Exactly. And these are state lawmakers, who don't have medical degrees, but they're tying the hands of these boards by saying you can't do anything against these docs who prescribe these medications, which are not recommended and not approved for COVID.
So underfunded boards, politicized laws that are tying the hands of boards. I'm also wondering about the responses that doctors have, because they are charged with violating the Medical Practice Act in a particular state, but they get to defend themselves. So what would doctors say in response?
What we found is that doctors would typically say that this was their right as doctors, First Amendment protection on all the false and misleading statements that they would be saying on radio and testifying in state legislatures or in other social media. And they would say that this is their right as a doctor to do what they thought was best for the patients. And in some cases, these doctors were following, quote unquote, the protocol of these alternative groups who push ivermectin and hydroxychloroquine on the web to consumers who are really confused about what they should do and get pulled in by that messaging.
Now, interestingly, there's a Federation of State Medical Boards that provides guidance to medical boards. And they took on some of these arguments and said the First Amendment doesn't allow doctors to say certain things. Generally, it doesn't override privacy protections, for example. It doesn't override clinical standards, and that it is acceptable for a board to take action if the advice that doctors are giving, even if it involves words, is actually putting their patients in harm's way.
Yeah, but the Federation of State Medical Boards can only make recommendations. They don't have any enforcement. There is no organization that says, all state medical boards, you must do this. This is our health system. So the states have the power to do what they want with their state medical boards, and the state medical boards control what their doctors do. There's over 1 million doctors licensed in this country.
So do you think these free speech type arguments may have been successful for doctors? And when the boards were able to take action, how did they overcome that?
I think in some of the cases we looked at, in particular one case in Maine, initially the board drew up a longer list of allegations against this one doctor, and that included several misinformation spreading allegations. By the time the board said, we're going to hold a hearing and look into these allegations, many of those misinformation allegations had been withdrawn. And the focus was on what other clinicians had told the board about patient harm. And there were examples of patients who had been prescribed ivermectin or hydroxychloroquine and had to go to the hospital and had to be intubated and couldn't breathe because they had been not given the proper treatment.
Got it. So here we are. The pandemic is starting to fade in the rearview mirror. We haven't really created a single national story on COVID. There's still a lot of disputes that are out there. What do you think the legacy of COVID will be for medical boards and physician discipline?
I think they're realizing, but maybe too late, that this is an area not just for COVID, but for future health crises, that there needs to be stronger action and maybe more proactive action, and maybe not just the state medical boards, because what about the certifying bodies? You can't practice in a hospital. Obviously, you need to have your license, but if you're not board certified in that specialty, the hospital will not usually want you. And I think there more broadly, there needs to be a much bigger focus on attacking this misinformation question by all folks in the House of Medicine much earlier, because now the genie is out of the bottle and the trust in scientists, in physicians, in public health is so low that I really worry about what will happen the next time around.
So a more organized approach to misinformation earlier, explaining to doctors what the guidelines are, what really is appropriate medical practice with respect to things that people may read on the internet could be helpful, not just for the remaining COVID surges that we have in front of us, but also for a bunch of other issues.
Exactly. You can't wait for the problem to happen. You have to see where the puck is going and go ahead.
Lena Sun, thank you so much for joining me today to talk about your great investigation.
Thank you for having me.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Holly Cardinale, Philip Porter, Spencer Greer, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Fernandez and Shian Briscoe. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.